Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning and welcome to the Senior Moment Show. We're back for another show. My name is Bruce Lee. I'm here with my co-host Sid Roeder. Good morning, Sid.
Good morning, Bruce.
How are you?
I'm good. Glad to have you back.
Glad to have me back.
That's right. You weren't there last week.
Well, I was someplace.
Exactly.
Just not here. That's okay. Before we get started today, we need to talk about our sponsor, Sid.
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and efforts to provide information for seniors, their family members, and really anybody who cares. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info. You can also email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any questions or any guests you would like to let us know about that we can invite, you can reach me personally at 435-512-6406.
Thank you, Sid. Have you had a question that stumped you yet?
No.
No.
Not stumped.
We need to lay the challenge out there to our listeners that the Stump Sid contest. Send a question to Sid.
Let's not.
Okay. All right. Well, we have some guests with us today. Sid, we've got the group from Connected Medical. So we have Rob Phelps and Brent Scow. And they have been on the show before, but we want to welcome them to the show. Welcome, gentlemen.
Thank you.
Thanks. Good to be back.
They're both very excited to be here. We're excited to have them. Before we get started, I'll just say that their service is maybe not well known and is certainly underutilized and is going to be of interest, I think, to people that are listening. I would tell you now, maybe get a pen and a piece of paper because you're going to want to write their information down here in a little bit when you hear the things that they do. But let's see. Let's start off with Rob. Rob, why don't you introduce yourself and tell us a little bit about yourself, and then we'll hear from Brent.
All right. My name, like you said, Rob Phelps. I've been working in healthcare in the Valley now for over 30 years, primarily with the elderly or geriatric population. I was one of those people that went to nursing school and was always just going to work straight emergency medicine and trauma and all that. But I found a passion for caring for the elderly and the vulnerable population. And it's just, I fell in love with it, and it's what I do.
Awesome. Brent, tell us about you.
Yeah, I'm a nurse practitioner. My name's Brent Scow, and have been a nurse practitioner for about 5 years now, and started kind of like Rob in trauma and orthopedics, and then from there gravitated towards doing more geriatric and elderly care as well. And, just, again, the ability to help people that really don't have the ability to help themselves was really something that was interesting to me.
Awesome. Just a quick question for those who might not understand the difference, because there's lots of different types of nurses. And so when you say nurse practitioner versus like maybe an RN registered nurse or an LPN nurse, what's the difference? Where do you fall into that, Brent?
Yeah, that's a good question, and I do get asked that a lot. A nurse practitioner is, they call it an advanced practice RN. A registered nurse typically does the basic patient care. They take the orders from the physician and implement those orders. Nurse practitioner is an RN that has gone back to school and done additional training and would be considered a mid-level healthcare provider. In the state of Utah, we have all similar privileges as that of a physician to sign different orders and prescribe medications under our own license. So it's pretty similar to a physician assistant.
Wonderful. Let's maybe dive a little bit, Brent, into the type of service you provide so we don't get any confusion, because you are not the doctor's office that you go to.
Yeah, we do what we call a mobile primary care practice, where we go into people's homes and into assisted living facilities and skilled nursing facilities and see people in person versus having them come into a clinic setting. And this is kind of focused on people that are unable to get into a physician's office due to poor mobility, no transportation, mental health issues. It's typically, that elderly population that rely on family and other sources to get to the doctor or are in a facility. So that's kind of our focused group that we
So
see.
this is actually you, Brent, doing this, right? This is how you spend your day normally when you're not down here playing at the radio station. You're normally out visiting patients.
Yeah, so it's kind of that old black bag medicine.
Yeah, I think
where you
of
go
Doc
and-
Baker
Yep.
on Little House on the Prairie. What's the difference between you and Doc Baker? Really, I mean,
I'm not
much.
delivering babies at home, so
You don't use a horse.
I'm not in a horse and buggy, but
But
other
very
than
similar,
that,
though, really.
Really similar, yep. And we do have a physician that does oversight as well, but I am the one that sees most of the patients for our group.
So, Brent, do I interpret that correctly then, that you are not, this is not emergency care you're providing, this is more the regular checkups, the seeing if the medication is working properly type of care?
Yeah, it would go back to just regular primary care. We're not in urgent care. We can help sometimes in urgent situations, but if there's an emergency situation, we refer people to the emergency room, and we rely on people to just make appointments. That way we're prepared and can handle any situation that we go into.
Right. So your visit is very similar to going into a doctor's office, right? It's the cost of it. Is there a premium charge to have you come out versus to have to get into your car and drive to a doctor's office?
No, it bills the same as a regular office visit would bill directly to the insurance company, and there's no additional cost for us going to meet that person in person. So like going to the home or the facility, it's not an additional cost.
So what area do you cover? I'm assuming for sure all of Cache Valley, but how far out do you go?
We do Cache Valley, we go down to Brigham City and over to Tremont, and I also go up into southeastern Idaho as well because I have both an Idaho and a Utah license.
So I know we're getting ready for our first break. Before we go to that, though, can we get a phone number, contact information for you?
Yep. So the name of the company is the Connected Medical Group, and phone number is 435-535-1668. Again, that's 435-535-1668, and that goes directly to my medical assistant that helps me. Her name is Emily.
Thank you, Brent. It's great to have you guys here today. This is the Senior Moments Show, visiting today with Rob Phelps. He is a nurse, and Brent Scow, a nurse practitioner with Connected Medical. And I'd like to mention our sponsor really quick before we get into the break. Our sponsor is the Empowering Senior Group. If you'd like to learn more about them, you can do so online at empoweringseniors.info. We're going to take a short break. Stay tuned. We'll be right back.
Whether you have a small business, large corporation, or sole proprietorship, remember Cook Martin Polson has provided quality accounting services since 1977. At Cook Martin Polson, they believe you've earned it, and they're going to help you keep it. Take a minute right now to call 750-5566. That's 750-5566 to set up your tax appointment and let Cook Martin Polson show you how to keep the money you have earned.
This is Jared Ripplinger with Cook Martin Polson. You've worked hard for your money. Let us help you keep it.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
This is Mark Thurston from White Pine Funeral Services. On behalf of all of us here at White Pine, we want to thank the community of Cache Valley for your support this past year. Thank you for selecting us as a silver winner for the Best of Northern Utah. We look forward to many more years of working with you here in our community. We know you have a choice, and we hope you will consider White Pine Funeral Services. If you have questions about cremation, funerals, or planning ahead, please contact us or visit whitepinefunerals.com.
White Pine Funeral Services, here when you need us most.
Thanks, Mom. Thanks, Dad.
No problem, sweetie.
I can't believe you're able to fit everything in that little sedan.
Bye!
When they move out, you can move on to a house that fits your life. It's time to live in a space that fits your family.
Hi, this is Sid Roeder with Achievement Realty.
Let me help you to find a home that suits your needs and is less to take care of. Save money or even make money on the sale of your current home. Call me today at 512-6406, then list it, sell it, and move on.
Welcome back to the Senior Moment Show. If you're just joining us today, my name is Bruce Lee. I'm here with my co-host Sid Roeder. We're talking with Rob Phelps and Brent Scow. They are with Connected Medical, which is a group that does home health visits. And the break, Rob, we were talking a little bit about Connected and kind of how it got started. Can you kind of give us the backstory on how this idea came about and your involvement with that?
Yeah, it's really been a process of about 30 years of healthcare and learning what the needs are of the community. I've done about everything you can do, from a CNA to an LPN to an RN. I've done pediatrics, I've done geriatrics, owned home health and hospice agencies, owned a skilled nursing facility. And regardless of the situation you find yourself in, I think anyone who has worked in those environments can attest that there's just always families coming in crisis. And most of the time, it's because they really don't have a plan, or they don't have a primary care provider who is able to spend the time with them to help them create that plan. And whether that's, somebody moving a parent in from out of state now that needs to be cared for, or a relatively healthy couple who one of them receives some devastating diagnosis out of the blue. They don't know where to go. They don't know what the resources are that are available to them. They get frustrated trying to get into a physician's office to get appointments in any real, good time frame. So this really was born out of necessity in helping those people get their needs met as soon as possible and in the best way possible. Utilizing the nurse practitioners and limiting, how many visits we do. We're not trying to see 20 or 30 patients a day. We're trying to see 8 or 10 patients a day. We try and keep availability for those people who need to be seen that day because they have a new situation in their life, or they need to get someone admitted to an assisted living facility or a skilled nursing facility, but don't have a physician that is familiar with that individual that can write those orders for them in a timely manner. So it really was born out of need and just a passion to help people either avoid those emergent situations or deal with them as the best they can when they do come along.
So, Rob, how do people typically find you then? Is it physicians that refer to you sometimes, or is it how do they come to realize that you're there and you can help with that situation?
Most of what we do is word of mouth. It's facilities that we're already taking care of people in will refer new people over to us when they have the need. We do get some referrals from physicians. Especially, specialists from outside of the valley who are sending people back to the valley, and they maybe don't have a primary care physician that has been following their general health. So we'll get involved with them to do the general health care and communicate with that specialist with those needs. So really, most of what we do is just word of mouth, and people who have been helped by the service referring friends and neighbors and family. So if I can, let me see if I can summarize, if I understand this right. So if I were to draw a line around the
border of where you guys serve. It'd be maybe from Malad down to Brigham City, south end of Cache Valley, up around Preston, up into southern Idaho area, just kind of that circle. In the service, the people that you're serving are people that are homebound or in their homes, and you're basically bringing the doctor to them.
Yeah.
And so if they're sitting at home and they're like, gosh, it's hard for me to get to the doctor when I need to go. I can't drive, or whatever the problem might be that way, whatever obstacle would be, they're preventing them from getting to the doctor, getting to their primary care physician. Your service can actually come to them, and the charge for that is the exact same as it would be if they got into their car and drove to a doctor.
That's correct. Yeah. Do they call us? They get on Brent's schedule. He goes and sees them in their home. Their visit is generally longer than it would be if they were in a clinic.
Talk about that for a second, because I know that's kind of a big deal. In a clinic, the visits have a time frame on them typically, right? You need to get a certain number done, and you guys don't have that same constraint. You can spend a little longer to find out what's going on with people.
Well, yeah, and by no means do I want to throw the clinic setting under the bus here, because they're great and they're very much needed. But there are people who just can't get there, or can't get there with regularity, and so they just don't even try. So yeah, we do spend extra time with them. Another crucial thing to our care is Brent sees them in their home setting. He sees them as they really are. A lot of times we see people will come into a clinic and they kind of put their best foot forward for that 15 or 20 minutes or however long they're there. Where in the home setting, Brent can watch and see them interact with their living environment. How do they move about their home? How do they store their medications? How are they taking their medications, or are they taking their medications? So we can get a really true picture of not only physical needs, but a lot of times the psychosocial needs, the family environment, the caregiver situation, and get a really true picture of what that individual's needs are. And then we can educate them and help them as to all of the other resources that are available to them in their situation, and really just ensure that they're getting the full gamut of care that is available to them and that they need.
I can only imagine that can, under certain circumstances, make a huge difference in the way you treat, too. Is there any, we're coming up on our break quickly, but is there a short story that comes to mind where maybe being in the home made a difference to that patient?
Yeah. I mean, everyone. There's a story.
Day, yeah.
Every door that we walk through has a story behind it, and whether that's helping someone get on hospice services in a timely manner so that their pain and symptoms can be controlled through the end of life, or simply helping them understand the process for applying for Medicaid resources, or linking them up with a private duty caregiving service that can allow them to stay in their home versus going into an assisted living facility. I mean, really, every door we go through, there's a very individualized and very unique story that we're able to be a part of.
Thank you so much, Rob. We're coming up on our second break here, so please stay tuned. We'll be back in a jiffy.
Did you know 10,000 baby boomers qualify for Medicare every day? Did you know that you'll start to get swamped with mail about Medicare 6 months before your 65th birthday? Did you also know it doesn't cost anything to use an insurance agent to help you navigate through all those offers? Hi, I'm Tracy Ferris with Quality First Insurance. Let me help you understand all the offers you're receiving and find the plan that fits best for your situation. Call me today at 435-752-0101.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
If you're retired or plan to retire soon, will you outlive your money or will your money outlive you? If you don't know the answer, I can help. Hi, I'm Patty Bartholomew, a financial consultant with Parsonex Securities. If you have questions about your financial plan or just need a second opinion, call me today at 435-227-5556.
Investments are not FDIC insured, nor are they deposits of or guaranteed by a bank or any other entity, so they may lose value. Investors should carefully consider the investment objectives, risks, charges, and expenses of the funds. This and other important information is contained in each fund's prospectus and summary prospectus, which can be obtained from a financial professional and should be read carefully before investing. Securities offered through Parsonex Securities, Inc., member FINRA, SIPC, 8310 South Valley Highway, Suite 110, Inglewood, Colorado, 80112-303-662-8700.
When it comes to successful aging, eating well matters. Staying physically active matters. Getting socially engaged matters. Living alone, aging alone, it's harder to consistently do that. Hi, this is Chris Grohl with Pioneer Valley Lodge, where we make it easier to do those things every day. Our mission at Pioneer Valley Lodge in North Logan is to help seniors live better, age more gracefully, and stay independent for as long as possible. Pioneer Valley Lodge, an independent living community for seniors.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG, and they will take care of you.
Welcome back to the Senior Moment Show. If you're just joining us today, we're here with Rob Phelps and Brent Scow from Connected Medical, and we're having a great discussion about how we can roll the clock back, I don't know, let's say 120 years and get medical care at our homes. And I want to say Doc Baker, but it's not going to be Doc Baker. It's going to be Brent Scow who does it. Brent, I guess to that point, give us a day in the life of Brent Scow when you wake up. What's it? What time do you get started in the morning? About how many visits do you see? What do those look like for you? What's that like?
Yeah, a typical day for me typically starts just at home. Get up, and I usually will have reviewed my schedule the night before and kind of plan my driving route around that schedule. But it's basically just going to facilities or to people's homes to see them. Because we don't have office staff or different things like that, a lot of phone calls are made, hands-free, of course, en route to get
Always
patient information and get things prepared for that ahead of time. But typically people will just call and set that up, and it's all pre-scheduled and planned out already. And just go around and see those patients and help coordinate cares if necessary. We also help in different facilities, kind of manage patient care in those facilities as well.
And what kinds of things are you seeing them for? What are their needs? What are they calling about?
We do see a lot of patients and do dementia-related cares for Alzheimer's or dementia, and helping manage those cares, whether it be, helping them cope with the restlessness and agitation that comes from that, or different behaviors that can come from that, mobility issues and concerns that come with that. And we help the facilities understand that a little better, how they can manage it, and then how managing with medications can tie into helping better control those patients and helping those patients be more comfortable. It's really hard for them as well. And so we do a lot of that type of care, a lot of falls and weakness and different problems that come with the aging process, and we help coordinate services with home health, or as Rob mentioned earlier, we help coordinate a lot of hospice services as well for comfort care.
So let's talk a little bit about the process. I don't know which one of you wants to answer that, but what typically happens when someone calls in with a need and says, we're not mobile, can you help?
So if someone contacts us, if they call our main number or reach out to one of us as an individual, we'll get them in touch with Emily Hendricks, our medical assistant. From there, she'll get the information that we need to bring them on to services, a consent to treat, get their insurance information. And from there, she puts them on Brent's schedule according, we have to be as efficient as we can with our travel and different things. So she'll get them on Brent's schedule. She will also work with any providers that they have seen previously so that we can get any history information. If there's been a recent surgery or a trip to a specialist, we'll get those notes. So we have a pretty good idea of what's going on with the patient before we get into their home. From there, Brent just goes in and sees them. We establish care with that primary visit. A lot of that is really working with that individual and their family to find out what their treatment goals are. Do they want a very aggressive, curative type approach? Do they want more of a palliative or a just comfort management of symptoms of a chronic illness? Or, do they want, like we said, home health? Do they want to look at a facility or placement somewhere where they can get additional care? And then once all of that is established, then we go down that road. But our primary goal is finding out what their treatment plans are and helping them achieve those in a comfortable and dignified way.
We probably ought to get that phone number again. It'd be a good time to ask for that. So if they call, they're going to get Emily, right?
Yeah, if they're lucky. If they're unlucky, they'll get Brent or I. But if they're lucky, they'll get Emily. The number is 435-535-1668. And that's the main number for Connected Medical, 435-535-1668.
And I guess if people are listening and for some reason they want to connect with you guys and miss that number or whatever, they can always call you, Sid, as well, right?
Absolutely.
So your number again is what?
My
Sid?
number.
Yeah.
Oh, sorry. I was waiting for Rob here to mention the same number again. Well, my number is 435-512-6406. You threw me for a loop
I
there.
did. I'm sorry. I should have prepared you better for that. But just and really on anything else we have on the show, if people have questions that you can follow up with you. But anyway.
Yes, and via email too. We mentioned the email all the time too. But if you would like to email us, it's empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley.
And I will throw out my email as well. If you want to contact us directly through Connected Medical, it's rob@connectedutah.com. That's rob@connectedutah.com.
Thank you guys for coming in. We're coming to the end of our show. I do have to comment though on your Emily though. She sounds like she might be a little miracle worker. I can't even imagine with the area you're covering how she gets your schedule in order so the driving makes sense and you're not zigzagging through the world here. So again, this is the Senior Moments Show. We were visiting today with Rob Phelps. He's a nurse, and Brent Scow. He's a nurse practitioner with Connected Medical. We learned a lot. Thanks for coming in, guys. We'll hope you tune in again next week.